will present some results from the screening conducted for viral hepatitis in Roma community in Tirana during the 2015. Roma in Albania are recognized as an important ethnic linguistic minority, and the population of Albania is around 2,800,000 inhabitants. This is according to the census done in 2011. Officially, there are about 35,000 Roma individuals in Albania, and only in Tirana there are around 10,000 persons. But the largest communities, Romani communities in Albania, are found in the central and the southeast region. This is a map that shows the distribution of Roma communities done after an initiative of our Institute of Public Health and the National Program of HIV, mapping all the Roma families all over the country. And the distribution is in 2005, but also nowadays there is no changes in Roma distribution. Some data related to hepatitis B in general population and in Roma. Prevalence of hepatitis B in general population in Albania is around 7 to 90%, according to a study conducted in 2009, and in Roma is 13% after a bio-BSS study conducted in 2005. Since 1994, in Albania, the vaccination against hepatitis B is mandatory for each born babies in 24 hours at birth, and the vaccination coverage in general population is over 95%. We can say the vaccination coverage in Roma children is good in the first doses because it is due to the vaccination at birth done at maternity houses, but we have a decrease of this coverage on the other doses. And in 2014, for example, in Tirana, there is 99% of Roma children which are born are vaccinated at 24 hours at birth, and then we have a decrease from 90% in 2 months, 67 and 57 and 6 months. Anyway, the National Immunization Program has conducted several vaccination campaigns in order to reduce the gap and to increase the immunization. The objective of the screening, it was to estimate the prevalence of hepatitis B in Roma population in order to increase the awareness of the population about this disease and to promote the vaccination process. As method, this is a cross-sectional study, was conducted in Tirana district areas in 7 areas, and these are with non-limited population movement. The sampling, it was done according to the method of probability based on population size. An open AP was used to calculate the sample size, and the laboratory methods used were the immunochromatographic method, rapid test, and ELISA. A positive case is considered any person that tested positive for HBs antigen with rapid test and then confirmed with ELISA method. The selection of individuals participating in the screening, it was done in 4 steps. First of all, we had an agreement for the screening process in the healthcare centers corresponding to 3 rural and 4 urban areas selected. The second step, the selection, what was done at random inside for each Roma person 19 years old and older arriving in the healthcare center in the same day. Before collecting the serum samples, a sign of consent, it was signed a consent form from each person, and to each serum sample was attached an individual questionnaire with some demographic data. And after all, for each positive cases are referred to the specialist for further follow-up. The table shows the 7 areas selected, the 3 rural and 4 urban, with corresponding population and the number of samples that we have to select and to collect serum samples. And in total, the sample size was 174. The distribution of all tested persons by age group, we saw that the age group of 25 to 44 years old were more participating in the screening, and the minimum of age was 19 and the maximum was 59 years old with an average of 33.7. And tested persons were more female with 70.1% than males for all 174. And result for positive phases, 25 out of 104 resulted positive for hepatitis B, and the prevalence of HBs antigen was 15.5%. And among positive cases, the highest positivity was among males. The distribution of positive cases by age group, the age group most affected with highest positivity was 25 to 44 years old, with 19.4%. And the area most with the highest positivity was the Tufin area, which is a rural one, and followed by healthcare centers number 8 with 23.1%. This is the map of Tirana showing the distribution of positive cases. The center of Tirana in white, and it's Tufina with the most highest positivity of cases. We had two limitations in our study. First of all, the study was conducted only the areas with no limited population, and the laboratory testing were only rapid test and ELISA and not PCR. And we can say that in among Roma population, we still have a high prevalence of hepatitis B in Tirana district, and the age group most affected were 25 to 44 years old. Most of them are unvaccinated and also are the most active age group. Males have the highest positivity for hepatitis compared to females, and Tufina and healthcare center number 8 are the most affected areas. As a recommendation, we recommend to enhance the promoting and educating healthy behavior and vaccination in order to increase the vaccination coverage, to improve the sentinel surveillance in those groups, to screening not only in Roma population in Tirana, but also in other districts in Albania, and to improve the collaboration with NGOs that we know that in Albania they have a strong activity among Roma population, almost in education part. And I would thank all my colleagues from the Department of Infectious Diseases in Institute and in Directorate of Public Health of Tirana, and also all the staff to the healthcare centers that helped me. And thank you.
Thank you, Elona, for this nice presentation. You keep a time. Thank you also for that. 10 minutes. Is there any questions to Elona? You're welcome. It's very interesting, yes?
Thank you for the presentation. It's obvious also. I want to make some question, and other one is comment. Why you use the number of participants for females maybe more than 75% in the sample? Yes, most of the participants are females. Most of them are females, not males. Why? The second one, you said that you can do the test by ELISA, not PCR. It's correct. ELISA is better. You should make screening the first time. Should make screening by ELISA methodology. Then you can confirm, or for PCR, it is used for monitoring the viral loads of the viruses in the blood, and also it is used for the treatment purposes also. This I want maybe to clarify this issue. Okay.
No. Okay.
About females.
About females, the selection of individuals, it was done at random at site. So we didn't select more females than males. But in the same day that are coming, females are more accepted to be part of the screening. So, and yeah, because the selection of the person is what at random. So in the same day that they come, they accept to be part of the screening. So there were more females. Oh, yeah.
Can I have a next
Yes,
question?
yes.
Because females, Roma females, they go
More, yes.
Centers.
Also,
And the Roma males, they never go to healthcare centers. Yes,
It's
it's about
about,
their
yeah.
culture. So it's a cultural and behavior issue. So if you want to involve males, Roma males, you usually work with Roma leaders.
Yeah, thank you. I understand Ibrahim issue because if you put that it is these findings, it's not representative for even the Roma community in Tirana because there is no random selection of participants. If you said you choose a probability cluster to find the number of participants, then those who are more female come, and this is changing. And also it's interesting just to explain, maybe it is not possible because if you don't ask them more questions, it's interesting that twice more males are positive. Maybe they have some risky behavior which differ them from females. Yeah.
Yes, but I didn't put, okay. I didn't include it, okay. About risky.
Yeah. You're right. Okay.
No, PCR is useful screening.
It is useful screening, yes. PCR also. No. Okay, they say to me, yes.
Could you explain more about the differences in the prevalence among males? Or you have no information why it's higher?
Okay, why is higher? Maybe because they have their behavior, let's say, unprotected sex and multi-partners. Because we can say that Roma population are very difficult to reach them, and so. And maybe, they also are injecting drug users also that influence in the higher prevalence of hepatitis B among males.
Okay, is there any other question to Elona? Yes?
Thank you, Elona, for the interesting presentation. It's interesting because the Roma population is difficult to reach and to have access to different services, so it's very important. My question is, you said that the highest prevalence was in Tufina, in a rural area. Any idea why the prevalence of hepatitis B is higher in rural areas versus the urban ones?
Okay, Tufina has a higher population. The number of population in Tufina is, there are,
No, just because we know that hepatitis B is higher among those who have more risky behaviors. So for me, why should it be in rural areas higher prevalence of hepatitis? Just your ideas, your explanations.
okay, okay.
It's okay, just asking.
There's an explanation there.
Yes.
I mean, first, Tufina is not a real rural areas.
Okay.
It's a suburb. So, and it's a suburb which includes people from all backgrounds. And the Roma population concentrated there are people who have more risky behaviors, and their level of poverty is much lower. So this is the one of the reasons could be.
Any other question? No? In perspective of public health, it's very interesting because in every country we have Roma population.
Yes.
What is situation in Albania? Because you said very nice that the almost 100 of them receive first dose of vaccine.
Yeah.
And then there is increasing coverage. Are the Roma population children have health insurance card? What is how it is regulated in Albania? Or maybe some other reasons are influence that lower coverage?
No, okay. The vaccination is mandatory in Albania against hepatitis B and is offered free of charge for every children, included also Roma population in every GP's practitioner. So even if they don't go for vaccination in the second or third doses, different campaigns are in place, yes, for increasing this, increasing the vaccination coverage, and there are campaigns that are conducted for from our immunization program, national immunization program in our institute. So.
It's not the question you made. Can I explain? Okay, if you saw from Elona presentation, it was the incidence, it was 10.5% to the age group under 25 years old. And the vaccination started in 94.
Yes.
But the proper vaccination against
Hepatitis B, because in '94 started with some funding and help from Rotary Club, but Albania introduced the proper vaccination against hepatitis B in '99. So this is why we do mopping up and campaigns against hepatitis B. But the incidence has been 20%, and now you have 10% in that group right now. So the incidence in the Roma population in that group is very similar to general population, because Elona said it's 7 to 9%
In general population.
in general
yes,
population.
we have
So
high
it's more or less the same. And the highest one is in 25 to 44. And even in general population is 25 to 44. But it's a little bit less compared to Roma population. And Roma are underprivileged still, according to housing and the poverty level, which is true. But they have full access to healthcare,
Yeah.
and they are insured, because they have an insurance card, because they are insured by the state, even they don't pay insurance.
Yeah.
So this is the law, insurance law.
Yes, you're welcome.
Is there routine screening for Hep B in pregnancy?
Just take a microphone.
Oh,
Hi, Aileen Kitching, MediPIET Alumni Network. I'm just wondering about the women who came forward for screening. Is there routine screening for hepatitis B in pregnancy in Albania?
No.
No.
There is no. Yeah. Yeah, at birth. Very high in the prevalence. B, yeah. We are an endemic, yes, country.
Just many countries also, like they do full screening in pregnancy for Hep B and HIV, you know, even where they offer
A new
vaccination.
protocol, yes. Oh,
Thank you for this question. You have a question also? The last question.
Just to clarify, you mentioned both of you that the highest prevalence is among the population 25 to 44. What about the oldest age group once the immunization program has been implemented in 1994? So, would you clarify?
No, please. Okay, sorry.
No, among the study, it's obvious because the highest proportion of people that are coming for the study design is among this age group. I understood that. But once she mentioned that even at the population level is the same prevalence, so how it could be why the oldest age group are not having prevalence of high hepatitis? You
Yeah.
they had risky behavior, but they had.
Yes, contact with household. There are a lot of mode of transmission.
Albania is a special study related to hepatitis B, so which are related to certain periods according to blood safety and safety of injections. And I mean, we don't have time here. We just had a conference on hepatitis because we are really working closely related to that. But is related to those periods that have gaps in blood safety, blood screening for hepatitis, and injection safety.
Okay, but the age expectancy in Albania, I believe it's not low.
No, it's not low.
So the
It's
people,
very high,
the
but
people who are
Albania has
becoming-
a very high.
the people who are becoming infected at the age group 25 to 44 will still alive after the 44, so the prevalence should be the same or even higher.
Where? Beyond? No.
Because they are
Not for sure.
still having unhealthy behavior.
Not for sure. In hepatitis B,
It's
not for
not,
sure. No, not for sure. You have a lot of carriers, but not for sure.
Okay, if you want, we can discuss after this session, just to give opportunity to other, because it's interesting to understand deeply. But okay, after. Yes, after. Okay, thank you, Elona.